and welcome to this short introduction to the Strengths-Based Approaches conference taking place over the next 2 months. This conference is one of a number of conferences organised by ExChange Wales. ExChange Wales brings leading researchers together with practitioners and users to share expertise, research evidence, and care experiences. It provides free, high-quality training to support the ongoing development of social care professionals. ExChange is led by the Cascade Research Centre at Cardiff University and is generously funded by the Welsh Government through Health and Care Research Wales. My name is Alisoun Milne, and I am Professor Emeritus in Social Work and Social Gerontology at the University of Kent. I've worked in academia for over 25 years. I worked in practice for 12 years prior to that, and I'm a qualified and registered social worker. One of my particular areas of expertise and interest is social work with older people and their families. I've been involved in critiquing and doing research on strengths-based approaches for a number of years. Interest in strengths-based approaches is growing. In part, this is driven by the policy agenda. The 2014 Care Act in England promotes it, and in Wales, it is an important element of the delivery of the 2014 Social Services and Wellbeing Act. Strengths-based approaches are also very popular with social workers themselves, and they may contribute to improved wellbeing for adults. What are they? Briefly, others will discuss this in more detail than I have space or time to do here. Strengths-based approaches are derived from the basic principles and aims of the strengths-based model developed in the 1980s for people with severe and enduring mental health problems. In addition, in the older people's field, it links to models of successful ageing and the concept of selective optimization and compensation. These concepts are underpinned by the notion of adaptation, the capacity to adjust to the challenges that the life course brings, minimize the effects of these and maximize protective systems, for example, social networks, support networks, and friendships, and also resilience, including coping strategies and financial and other resources. Lynn Romeo, who you will be hearing from during this conference, the Chief Social Worker for Adults in England, states that strengths-based practice is not a new concept. It reflects the core principles that lie at the heart of the social work profession. The approach recognises everyone as a citizen, including those in the most vulnerable circumstances and those with long-term needs. It's about supporting their rights, acknowledging responsibilities, and empowering them with skills and expertise. While there is some evidence of the value and benefit of strengths-based approaches, especially in social work, the terrain remains contested. Some practitioners think that it is basically good social work, whilst others that it helpfully challenges the rather rigid bureaucratic models of care management that have come to permeate adult social work. There is also a view that it is a model that can advance the status, role, and effectiveness of social work with adults and make it more visible and attractive to talented practitioners. Those who are more critical of strengths-based approaches consider that they risk shifting responsibility for resolving care and support needs onto the service user and their family. And there is considerable confusion about how strengths-based approaches differ from other aligned models, such as asset-based approaches or even person-centred care. There are also concerns that policymakers think strengths-based approaches may be a quick fix to resolving the multiple, complex, embedded problems that many service users face, especially those who access publicly funded social care. The evidence we do have strongly suggests that for strengths-based approaches to be effective, they need to be supported by infrastructural changes to the whole system. Usually by the system, I mean a local authority department for adult social care. They are much more than simply, quote, adopting a more aspirational approach to practice, unquote, and may well cost more too, or at least do not cost less. During one event I attended, a practitioner, speaking for others I felt, asked, but is a strengths-based approach really a thing? And if it is a thing, how is it distinctive from other approaches? This is a key question alongside its partner questions. What difference does it make to users, families, and also practitioners? How does it improve care outcomes? How does it link to issues of co-production? And what role do relationships play in its effective delivery? If anyone can answer these questions, it's the speakers and contributors to this conference. It's hoped that we can all learn from one another and engage meaningfully with practitioners and users who will be attending and can share their own experiences of working with strengths-based approaches. I look forward to seeing some of you on the 31st of March, when I'll be back, not in an Arnie sort of a way, I hope, to speak on the topic of critical reflections on the strengths and weaknesses of strengths-based approaches in social work and social care. I'll be reflecting on the outcomes of a recent project funded by the Department for Health and Social Care. Before signing off, I would like to say a big thank you to Dr. Alisoun Milne and Sian Lewis for organising what promises to be a great conference made up of a rich set of videos, webinars, podcasts and blogs from key thinkers and doers in the contemporary world of strengths-based approaches. Enjoy.